as individuals, we have ways or decisions or actions we can take. In our professional capacity, we can do more. We can raise our voice. We can amplify the voice of the community. We can be engaged at policy level with policymakers. We can build the capacity of the health, our colleagues within the health space to understand the impact of climate on health, and really also push our legislators and our government to make further investments.
Welcome to this episode of Connecting the Dots podcast with me, your host, Juliette. Today, I have the pleasure of being joined by Desta Lakew, who is a Group Director of Partnerships and External Affairs at Amref Health Africa. Her experience includes various roles in US-based university teaching hospitals and consulting with international organizations, the likes of UNDP and Public Health Innovations. She was instrumental in the establishment and leadership of the very first biannual Africa Health Agenda International Conference. Welcome, Desta.
Thank you so much, Juliette. It's a pleasure to be here.
Hi, my name is Juliette, and I'm the creator and host of Connecting the Dots podcast. I love ideas and problem solving, and my career in communications has led me down a path of curiosity. Why we do what we do, how we tell better stories, and how African scientists solve everyday problems. Join me on this enlightening and entertaining exploration of African science like you've never experienced before. Get ready to laugh, learn, and be inspired. In this episode, we want to really touch on universal health coverage and also looking a little bit at climate. But before we go into that, I would be interested to find out a little bit about Desta, your background, your professional career, and why you do what you're doing, and what the impact of that has been.
So I think, Juliette, I'm not unlike many other people who have left this continent, from the continent, born and raised in Addis Ababa, Ethiopia. And I left Addis during the revolution, during a period of great crisis for the country, where Ethiopia was experiencing one of the most severe droughts it had ever experienced.
This was in the early 80s.
This was in the early 80s.
I remember that,
yeah. So it was a very difficult period, and many people were leaving Ethiopia, either by the airport or actually skipping borders. So there's a lot of crisis there, a lot of challenges that we were seeing and experiencing. We actually left with my mother. You know, every story starts with a very strong woman, and the strong woman in my life was my mother. And she actually took us to myself and two siblings. One sibling had already left. My father was left behind. He couldn't leave at the time, the country. So a strong woman took us to Nigeria. And then eventually from there, she had 3 kids with her, myself and 2 others. And from Nigeria, her boss said to her, "This is not a good place for a woman who's alone with 3 children.
Yeah.
Go to the US, see if you can find a job. If you can, don't come back."
The movement from Ethiopia to Nigeria was by flight or?
By flight, yeah.
Okay.
It was by flight. She worked with the Economic Commission for Africa at the time. And so she left on a job assignment to Nigeria, to Ibadan. And there we stayed, I think, a couple of months. And from there, she was really advised, go to New York. And we were familiar with New York. So she went to New York with no job in mind, like many immigrants. When we left Addis, I have to say that there was a challenge taking money out. And I think at that time, per person, you could only take out $200. So with less than $1,000, if you think about it, that woman crossed the Atlantic. We got to New York. We stayed with relatives like every immigrant family has. We stayed in a 2-bedroom apartment with 10 people.
Wow.
Yes, until we were able to actually find our own place. She was able to find a job. And we were automatically in a space where we knew we had to perform. We knew the sacrifices that our families had made. Not just myself, but many Ethiopians who are immigrating away from the country realize we're here. Our parents have made a sacrifice, and we have to produce something. We have to be somebody.
Some results,
we
yeah.
have to then come back, because even in my father's time, in that time, in the 50s, People went for education abroad and they
Yes.
all came back home.
Yeah.
So in the same way, I think that in my mind, I knew I would come back home, even at that time. So I did my university there. I raised my children there. I started my career there in health sciences, and I worked at the Health Science Center, the State University of New York, actually, and then another teaching hospital in New York as well. And then eventually, once I married and had my kids, we moved to the suburbs. I started working in the nonprofit sector.
And all this time, you still had that yearning of coming back onto to the continent?
Juliette, they say that wherever your umbilical cord is buried is where you come back, isn't it?
I always thought that was a myth.
It's not a myth. So you always have that connection. You're a first-generation immigrant. There is always something that pulls you back. And being an immigrant in another person's country is not easy. You face discrimination, racism, things that you had never experienced in your own home.
Yeah.
You're now experiencing. So you are an immigrant, you are Black, you are an African. It's a challenging space to navigate, right?
In Kiswahili, there's a saying, I won't say it now, but there's a saying of, as a guest, you should never overstay your welcome. So it sounds like for you were constantly reminded that this is not home.
I think we all are. But, once you have children, you also settle and it becomes home, right? So in all of the years that I worked there, there was always a feeling in my mind that I would come back. Not that I connected. For many years, we didn't come back until the Mengistu regime was overthrown. But even once I came back, I knew coming home to me not just meant coming back to Ethiopia, but coming to Africa, because Africa is really home, right? So it took some time, many years, I'll not date myself, to come back. And when I came back to work with an organization that that really inspired me, and that was Amref. So I came back specifically to work at Amref. It was not coming back to search for an organization. I knew it was Amref because the kind of impact that Amref had in communities and the work that Amref was doing was so amazing. And it was about uplifting communities. It was about connecting communities in the last mile with, first level services at the minimum. When I came to Amref in my first month there, one of my colleagues came and said, I'd like you to help me organize a conference. And it was a scientific conference, and I said, well, what is it about? And why are you doing it? And it turned out that Amref did a lot of research. Our colleagues across the sub-Saharan Africa that work with us do research. And that research at the community level is really informing even our agenda and our strategy and how we actually navigate in terms of delivering health and in terms of advocating even for universal health coverage, right? So that conversation turned out to be the conversation that actually launched what is now the Africa Health Agenda International Conference in 2014. That's when we started it. And at that time, we really thought, we need to talk about big issues, universal health coverage. How do we make sure everyone has access to health? What are the key issues, whether it's communicable, non-communicable diseases, water sanitation? What are the key issues? What are the policy drivers? What's happening with research? So we looked at so many things in 2014, and it turned out to be a really good convening, and we engaged partners across the continent and beyond. And we have since been doing it biannually. And so for me, doing that conference was really critical because here was an organization called Amref that really honestly did God's work. And we spent a lot of time navel gazing. We did not look up to show the world what we did. Mm-hmm. And it was so important to make sure that we gained visibility and we became thought leaders in the spaces in which we operated. And that became sort of the focus of my personal agenda, was to say Africa needs a voice. It needs many voices. It needs voices that are premised on science. You've been talking about science for some time and research. So we need voices. Not only do we need the science, but we need people who can actually package that science into advocacy messaging, package that science, and actually build capacity of our leaders in the health space so that they can advocate for the right things, so that we can advocate for further investments, because that's what we need.
How would you explain your job and what Amref does to a 7-year-old?
That's a good question. My job is to make sure everyone knows and support an organization that makes sure people can access a doctor, can access healthcare.
Not necessarily even from the ground. It's just based on people's experience. So I like your direction in terms of working very closely with the community to be able to tap into that particular knowledge.
On our continent, our people actually are impacted by climate-sensitive sectors. Agriculture, marine life, their animals. We live within our community. And so many times in the health space, for example, we talk about One Health. When you do a health intervention, you have to look at the environment, the human, and the animal. And how do we create a different way of delivering health by really acknowledging the environment and everything else around that community, right?
Yeah, so, and how they coexist.
How we coexist.
Right.
So because we are dependent, heavily reliant on climate-sensitive sectors, anything that happens in climate will impact us significantly.
What opportunities are you seeing? We do not want to paint a grim picture, but, I'm sure there have been opportunities based in your area of work, your interaction with the global community, with government, with advocates, advocacy personnel. What opportunities exist?
What I have seen, and this is the third thing. You asked me about 3 things, and I told you number 1 is introducing climate health as a big issue for us to really debate, tackle, etc. Number 2, I talked about our vaccine injustice campaign that we launched to really look at injustice and inequity that we see here on this continent and elsewhere also. So the third thing now is that I'm really super proud of is really the kind of partnerships we've been able to make and the inroads that we have made in terms of engaging key stakeholders, from government to private sector to philanthropists to institutional funders and players in a global space. Our ability to attract and draw those partners to the table to really understand the critical issues that we are seeing on the ground, whether it's climate or otherwise, and engaging them in a way that they are now supporting this, that they are prioritizing this. So for me, that's the third key accomplishment within our organization that I am happy to be driving, is engagement of key stakeholders and partners that are not only putting their money where their mouth is and investing, but also supporting programming on the ground and also supporting advocacy at the global level to prioritize these things that affect communities where we'll.
We've been talking about the young people. I feel like this message, as much as it would apply to everyone, is targeted also. If we look at our politicians, if we look at our private sector, perhaps they have they have a bigger role to play there as well in terms of simplifying, how they work, their approach to business, their approach to leadership.
I think I wouldn't want to look at our politicians or our industry, whatever. I say, as an individual, there are things that we can do in how we live our lives. As industry, there are things industries can do to reduce waste, to ensure that there's no pollution, or reducing that, or reducing the impact of what they do on climate. Just as I said, there are so many industries that are harmful, that create harmful sort of results or outputs for climate, for the world, for all of us. But if we simplify ourselves and we stop thinking in that consumer mentality, and we look at how do we preserve. So how do we preserve the integrity of our world, of our earth? It's one earth. We don't have other options.
Yeah.
So in this one earth that we live in, how do we preserve the integrity of the natural resources we have been given? I know that's a little aesthetic, sort of like out there, but that's a reality. If each of us want to take, as individuals, we have ways, decisions or actions we can take. In our professional capacity, we can do more. We can raise our voice. We can amplify the voice of the community. We can be engaged at policy level with policymakers. We can build the capacity of the health, our colleagues within the health space to understand the impact of climate on health and really also push our legislators and our government to make further investments.
Yeah.
You see? So in a professional space, we can take the science from research, the science from community, right?
Yeah.
Yeah, and then we can translate that into something that is can be policy, can drive policy. But from an individual perspective, we have all an obligation.
A role to play.
I have 2 children. I expect them to have a better world. Mm-hmm.
What fascinates? What scares you?
What fascinates and what scares me. What scares me is that we are distracted as a society, as a continent, as a global world.
Yeah.
We are distracted.
Distracted by
so many things. We're distracted by politics. We are distracted by conflict. We are distracted by everything, and we are not taking actions that we should. We are not fighting for the right things necessarily all the time. Yeah, we are not recognizing that our world is interconnected. That what happens in Ukraine means the food prices here will be like this. What happens in Gaza means this. We're not looking at politics, what happens in terms of race relations, in terms of economics, in terms of the kind of investments or politics or policies we're talking about. Everything is connected. And we are so driven by our individual sort of roads, right? You are a policymaker, this is your focus, that we don't pay attention to everything else, right? So that scares me. What gives me hope, what really is sort of the bright side, is those young people. And we have a continent full of them. And they have energy, and they have creative ideas, and they are here and ready to tap into whatever work we're doing. So what really motivates me is that the solutions that we're looking for climate and health, they're not going to happen in my lifetime. They may not even happen in my children's lifetime, right? But what gives me hope is that young people are picking up this body of work, and young people are more conscious, and young people are more discerning sometimes in the decisions that they're making. I'm seeing a lot of that, and that gives me hope.
I like your point on what scares you in terms of distraction, because, I think a couple of years ago, the thing that used to concern me as a researcher, scientist, and now turned science communication professional is that when people debate or discuss issues, they're rarely informed. It comes from an emotional, perspective, or it comes from myths and misconceptions. Increasingly, I'm beginning to note that this is not a problem to Kenya or the continent. It's a global problem.
Yes.
The more the internet has opened up, you see the conversation. Social media has been either sometimes it's a pro, sometimes it's a con, but your fascination, I think I'm aligned, because I feel that the youth are the ones who will open up the space more and more and question their ways of thinking, their ways of working is completely different. So how would you advise parents to encourage their children, and set them on the paths to be the next Geo or other leading researchers or innovators? How do we inspire curiosity from our young generation, especially in the context of so many distractions and anti-intellectual conversations?
I would say, listen, always give children an opportunity to speak to you and listen deeply, listen carefully. It's not easy all the time. We don't do it. But what I would also say to parents is interrogate the school systems, institutions that are teaching your children, because institutions that teach your children are not teaching them creativity. And so we have an obligation as parents to understand how our children are being taught and whether creativity is actually encouraged in the schools. Don't jump to believe that your child's outburst was not good, because sometimes it's a creative outburst. So really, I heard many years ago when my kids were young, I was told, most parents, when their child is a great pianist, but not so great in mathematics, the parents run out and get a tutor to teach the child mathematics. But our investment should be in the strength of the child. It should be in the strengths of that area, such as art, for example, that inspires the child. So really, not just listen to your child, but invest in those areas where you see strengths already. Grow the strengths that your child innately has.
When we watch films and TV shows, there's been a lot of highlights on superheroes.
If I could be a superhero, it would be the person the midwife or the community health worker, who is actually at the community level providing intervention, who actually helps a woman deliver a baby wherever she is. It would be, that is the superhuman, character that we know. It is that community health worker that every day goes into the homes of people that live in their community and transform their lives. So that is the magic that we should be talking about. There are no villains there. Yeah, there are only heroes. And so for me, the heroes are those people who are working in the community, with the community, who are changing the health status of the community.
So as we wrap up your parting shots, it's okay, take a few minutes to think about it. And I could probably just summarize, we've had a look at your personal and professional career, moving from Addis, Ethiopia, to Nigeria, and then to the US, and beginning to look at public health, and then moving back to the continent to really look at how you involve the community in a lot of work in terms of how they address their own problems, how they contribute to the conversation. And now more so and increasingly with the climate change challenge, looking at how health gets into that space and how we also include the voices of the community as well as our youth. I just wonder, from your takeaways, or maybe something you want to leave our listeners with, what would be that one thing you want to make sure that if before they sleep tonight, if there's anything they have to think about, this is the thing that they should think about, or having discussions for the next couple of weeks?
I think for me is that change is hard work. There's just no way around it. And I think that...
And it's uncomfortable.
It's an uncomfortable space sometimes. But there is nothing that has been gained from not acting. And I think, maybe that's not the right way to put it, but I think that if we want change and positive change, not only do we have to act, but we have to also onboard others to act with us. We have to amplify our voices. We have to collaborate. We have to partner, and partner with everyone, partner across sectors. This is not a one sector job. Yeah. So how do we partner? So for me, the parting shot is, it's hard work, but together we can make a difference.
Thank you, Desta. You've been listening to Connecting the Dots podcast with me, your host, Juliette. Connecting the Dots is recorded and produced by Teamwork at AMP Studios in Nairobi, Kenya. Join me, Juliette, as I interview the next amazing African scientist on the next episode of Connecting the Dots podcast. It is available on your favorite podcast app on Apple or Android. Don't forget to subscribe, share, and tell a friend or enemy about us.